minutes of questions.
Thank you, Chairman Wenstrup, for convening this important hearing. As this subcommittee has examined the U.S. response to COVID-19 pandemic, a disturbing trend has emerged. Public officials making decisions that were not based on science, but instead based on public perception and, even worse, political concerns. This became abundantly clear when Dr. Fauci appeared in front of this committee and testified that the 6 feet social distancing rule was not based on scientific evidence. In another example, in my home state of Pennsylvania, Pennsylvania Health Secretary Dr. Rachel Levine directed nursing homes to accept COVID-19 patients, even as she moved her own mother out of a personal care home. These incidents have fractured the trust between the American people and public health officials, which will only hinder our ability to respond to future pandemics. Governor Cuomo, during the COVID-19 pandemic, you acknowledged the danger, and you reiterated that today, giving your quote, "For nursing homes, you could have instead utilized the tremendous federal help that was offered to New York in order to help alleviate the strain on the hospital system." Governor Cuomo, rather than sending COVID-19 positive seniors back to nursing homes, why did you not work to have more patients directed to the temporary hospital at the Javits Convention Center?
Yeah, and Doctor, several quick points. Number one, there were no tests at the time for residents. Number two, the directive said you will speak to the hospital and get discharge instructions. The nursing home could say, if this person is possibly positive, I can't take them, period. It was totally in their discretion.
But had this temporary hospital, had the Javits Convention Center been utilized for more nursing home patients to remain hospitalized rather than being sent back to nursing homes, in effect, ultimately causing those deaths, could you have prevented not only additional nursing home patient deaths, but the transfer of COVID to the healthcare professionals who ultimately were responsible for their care?
We had facilities.
Did you transfer patients? Did you authorize them to be transferred to the Javits Convention Center?
We didn't even have to get there, because any nursing home that said, I can't take this person, we had alternative COVID hospital-only facilities. We had them all through the state. So a nursing home could say, I can't take this person, it may have COVID, I can't quarantine them, and we had other facilities for those people. That's why it wasn't just total discretion by the nursing home.
It was lack of leadership from your office. During a crisis, the American people deserve leaders who are empathetic, utilize science, and are honest with them, who put aside personal and political concerns in order to make sound, evidence-based decisions. It is clear from your actions and from what this subcommittee has uncovered and from what we've heard today from you, that you have failed to provide that leadership. And because of your ill-guided decisions, some of our most vulnerable citizens, those individuals who are in nursing homes, died. And that is on your watch.
Yeah.
Thank you, Mr. Chairman, and I yield.
The federal government